Alzheimer's disease is associated with what characteristics? A. Preclinical and symptomatic phases. B. Lewy body deposits. C. A more accelerated decline in older patients. D. Slow, irreversible organ failure. You are the nurse on call and receive a call from a continuous care nurse who states that her patient has started to have rattling secretions and the patient's wife is very concerned. You know from the report that this patient is actively dying. What would be the most appropriate response? A. Reposition patient on his side. B. Administer furosemide. Which characteristics are most closely associated with end-stage renal disease? A. 20% or less of normal renal function exists, consequence of coronary artery disease. B. Consequence of alcohol misuse, only treatment is dialysis. C. 10% or less of normal renal function exists, consequence of diabetes. A nurse is meeting a patient for the first time. When introducing himself, the nurse notes a series of symptoms that are concerning for acute stroke. Which symptoms are associated with acute stroke? A. Hyperventilation and bowel incontinence. B. Difficulty understanding speech and blurry vision. C. Vomiting and dyspnea. Which of the following most accurately describes breakthrough pain? A. Associated with pathological fractures. B. Refers to a new psychological or spiritual insight. C. Can occur as an end-of-dose failure. D. An aspect of opioid pseudoaddiction. Which patient is at most risk for undertreatment of pain symptoms? A. 86-year-old female with COPD, living in an assisted living facility. B. 74-year-old male with congestive heart failure, living with his wife. What should be prescribed concurrently with any opioid regimen? A. Ondansetron. B. Diphenhydramine. C. Senna. D. Pamidronate. Of the following, which may indicate a poor prognosis for the hospice patient with a diagnosis of end-stage cardiac disease? A. Infection. B. Edema. C. Unexplained syncope. When a hospice patient is facing increasing weakness, with increased fatigue and decreased mobility, which of the following is an important aspect of supporting the patient's care needs? A. Prioritizing energy use. B. Honoring the wishes of family members. C. Remaining as mobile as possible. Which service for the hospice patient would be paid for by the hospice Medicare/Medicaid benefit? A. Room and board in a nursing home facility. B. Treatment intended to cure the hospice qualifying terminal illness. C. Transportation and visits to the emergency room that are arranged by the hospice provider. After a patient's death, how long are bereavement services available to families and other individuals associated with the patient? A. Based on the degree of bereavement risk assessed, services can continue indefinitely. B. Up to 1 year following the death of the patient. If a patient and family are struggling financially, which member of the IDT may be most helpful in identifying available community resources for support? A. Hospice chaplain. B. Hospice social worker. C. Hospice aide. Which statement is most accurate regarding palliative hospice interdisciplinary teams, IDT? A. All team members can voice opinions, but the medical director is the final decision maker. B. Patients and their families are considered members of the IDT. According to Medicare guidelines, how often does a registered nurse need to visit the patient's home to supervise a hospice aide? A. Once every 30 days. B. Once every 7 days. C. Once every 14 days. What would be the best option for involving the patient and family in the IDT discussion in the hospice residential setting if they would like to participate? A. Ask them to attend the meeting in the conference room. B. Hold the meeting in the hall outside the patient's room. C. Hold the meeting at the patient's bedside. What is the best practice regarding the use of the electronic health record in patient care? A. Point of service documentation. B. Documentation for all patients in one sitting. C. Documenting in the office. D. Documenting before the end of the day. Although some variations in state laws exist, generally, a therapy, including palliative and end-of-life care, can be withheld or withdrawn under which condition? A. The patient's legal surrogate refuses it. B. Only when the patient refuses it. C. Only when an ethics committee investigation is conducted. Daryl has an incomplete bowel obstruction secondary to metastatic ovarian cancer. She is experiencing significant abdominal pain and is vomiting fecal matter. She and her family want non-pharmacologic interventions only. Which intervention is likely to be the most effective? A. Bowel rest. B. Nasogastric tube. A bedbound patient has a 1.5-inch foam overlay over her matters. The nurse places her hand under the overlay and finds that the overlay has compressed to 0.75 inches. A. Bottoming out. B. Adequate support. C. Excess wear. Which of the following drugs used for terminal sedation is a very rapid, short-acting benzodiazepine? A. Pentobarbital. B. Propofol. C. Midazolam. D. Lorazepam. In the last stages of amyotrophic lateral sclerosis, ALS, almost all patients A. Exhibit signs of dementia. B. Require mechanical ventilation to breathe. C. Have weight gain. D. Exhibit slight slurring of speech. The most effective treatment for relief of an elevated temperature of 38.8 degrees Celsius, 102 degrees Fahrenheit, is A. Acetaminophen or ibuprofen. B. Aspirin. C. Alcohol bath. A palliative care patient undergoing chemotherapy has developed myelosuppression. The patient should be advised of all of the following except A. Strenuous activities. B. Alcohol. C. High-protein diet. When the hospice nurse arrives at the home of a patient whose death is imminent, the daughter states, "I can't stay in the room when Dad dies. I can't stand the thought." The best response is A. You will regret it if you don't. B. I'll stay with him and you can come and go as you feel comfortable. When the nurse visits a hospice at home, he states, "I can't stand this pain anymore. I should just shoot myself and be done with it." The best initial response is A. I'm sure you don't mean that. B. Do you have a plan to hurt yourself? A 51-year-old hospice patient with metastatic breast cancer is experiencing severe pain in association with daily dressing changes of an ulcerating malignant skin wound. These pain episodes are consistent with A. Incident pain. B. Psychic pain. C. Spontaneous pain. The palliative care advanced practice nurse should be proficient in all of the following except A. Administering medication with the primary purpose of hastening death. B. Providing consultation to other medical professionals in complicated palliative care cases. C. Providing direct education to patients and caregivers. Typical features of late-stage dementia include all of the following except A. Urinary retention. B. Swallowing difficulty. C. Inability to walk. D. Incontinence. A 62-year-old hospice patient with lung cancer develops shortness of breath and facial swelling. The hospice nurse notes distended neck veins. The most likely explanation for these findings is A. Superior vena cava obstruction. B. Pleural effusion. C. Lymphedema. You are the nurse on call and receive a call from a continuous care nurse who states that her patient has started to have rattling secretions and the patient's wife is very concerned. You know from the report that this patient is imminent. What would be the most appropriate response? A. Elevate HOB, turn him on his side. B. Order oxygen for the patient. Mary is a 73-year-old patient with a 50-year history of smoking. She is very thin with a barrel chest, dyspnea, and supraclavicular retractions upon exertion. What level of oxygen may be most effective for Mary? A. 2 L per nc PRN. B. 40% venti mask. C. 6 L per nc. Which of the following most accurately describes breakthrough pain? A. Can occur as an end-of-dose failure. B. An aspect of opioid pseudoaddiction. C. Refers to a new psychological or spiritual insight. D. Associated with pathological fractures. Of the following, which may indicate a poor prognosis for the hospice patient with a diagnosis of end-stage cardiac disease? A. Unexplained syncope. B. Bleeding. C. Edema. Which of the following was the first hospice in the United States? A. Memorial Sloan Kettering Hospice in New York City. B. Hospice of the Western Reserve in Cleveland. C. St. Joseph's Hospice in Boston. D. The Connecticut Hospice in New Haven. The nurse is orienting a new staff member on a unit that cares for many patients at the end of life. Which comment by the nurse correctly reflects the principle of palliative care? A. We're busy because most people prefer to die in a hospital rather than at home where they would be a burden. B. Patients are eligible for palliative care even though they are also receiving curative treatment. The difference between the origin of hospice and palliative care in the United States is: A. The hospice movement was part of the establishment. B. The hospice movement was part of hospital-sponsored programs. C. Palliative care grew from academic, teaching hospitals. Which of the following is the best description of hospice? A. A type of care utilized when nothing more can be done for the patient. B. A philosophy of care to improve the quality of life for the terminally ill. C. A place where people are sent to die. When comparing eligibility for hospice care versus palliative care, which of the following is true? A. Palliative care allows for more aggressive treatment. B. Both have federal guidelines for enrollment. C. Palliative care is not holistic. The eligibility for hospice and palliative care is: A. 6-month prognosis for both. B. 6-month prognosis for hospice and no time limit for palliative care. C. Not affected by prognosis. D. Not affected by time limits. When is aggressive treatment not indicated? A. A cure is possible. B. There is a realistic chance of worthwhile prolongation of life. C. The side effects of the treatment are more distressing than the potential benefits. D. A patient chooses a clinical trial with informed consent. Currently, palliative care is primarily delivered in which of the following settings? A. Home. B. Acute care setting. C. Nursing home. D. Rehab setting. Most frequently diagnosed and leading cause of death from cancer in women. A. Breast cancer. B. Lung cancer. C. Liver and pancreas. D. Invasion. Most frequently diagnosed and the leading cause of death from cancer in men. A. Angiogenesis. B. Lung cancer. C. Metastasis. D. Invasion. Where does bladder cancer spread to? A. Bone, brain, liver, lungs. B. Liver, lungs. C. Bone, liver, lungs. D. Adrenal gland, bone, brain, liver, other lung. The spread of cancer cells from primary tumor site to distant sites in the body through one of several routes. A. Angiogenesis. B. Lung cancer. C. Metastasis. D. Invasion. A process where cells continue to divide, and with increased bulk, pressure, and secretion of enzymes, cancer spreads locally or into surrounding structures. A. Angiogenesis. B. Lung cancer. C. Invasion. Where does lung cancer spread to? A. Bone, brain, liver, lungs. B. Liver, lungs. C. Bone, liver, lungs. D. Adrenal gland, bone, brain, liver, other lung.